Today, I'm happy to welcome my guest, Tracy Brubaker. Tracy is the Chief Operations Officer of Vital Decisions, a company whose mission is to be the catalyst to change how individuals are cared for during an advanced illness, and they specialize in helping people with decision making. Tracy is a strategic change management leader, a business executive, and a licensed clinical social worker whose inspiration for service and leadership comes from Maya Angelou, who said, "People will forget what you said, they'll forget what you did, but they will never forget how you made them feel." Tracy is also a caregiver for her father, who is living with advanced stage CHF. And you can find more about Vital Decisions, which we'll be talking about a lot today, at the website vitaldecisions.net. So Tracy, thank you so much for joining me today.
Thanks for having me, Karen. Happy to be here.
Yeah, I've been really excited. Ever since I first heard about Vital Decisions, I was excited to talk about it and learn more about it and share that with my audience and the work that you all are doing there. But before we get into it, would you just tell us a little bit more about yourself, Tracy, and how you ended up at Vital Decisions and what your passions are?
Absolutely. Sure. So I have largely worked in the field of behavioral health for my entire career and in a variety of settings. So I've been in hospital-based programs and residential and outpatient programs, educational settings, and have been a direct care clinician. I'm a licensed clinical social worker and have also studied leadership and organizational development. So those things combined have resulted in a passion for me on helping people and organizations flourish. And so prior to joining Vital Decisions, I was at an organization in Center City, Philadelphia, helping them to stabilize. They were serving sort of the diverse population of Philadelphia, and I was in a role as Executive Director of Behavioral Health. And right about at that time, actually, is when my father started to decline in his health and had some really serious health incidents, which then, yes, led to his diagnosis of congestive heart failure. And so this also began to create a shift in my life. We live about 300 miles apart, and this began a journey of caregiving for myself. And I have two sisters who are also a part of his care. And this has continued now for about the last 5 years. And in the most, I don't know if you want to say providential or miraculous way, this was also at this time, I was invited to join Vital Decisions in a leadership role to help grow and scale this really innovative business, which at that time was about 5 years old. And Vital Decisions was in a high growth period. So now in my current role, I'm really honored in my role as COO that I have the privilege of overseeing all aspects of our people, clinical and business operations. And really, it's quite a humbling opportunity to serve the people that we care for. And I'm excited to share more about Vital Decisions with you and your listeners.
Yes, I'm excited too, because until I first heard about Vital Decisions, I had no idea that such a company even existed. Mm-hmm. And so I'm interested in the company itself and how it operates, but also after 10 years of helping people with advanced directives, what you all have learned and what wisdom you have to share with us about that. So I hope you'll just give us a little overview of Vital Decisions, but I wanted to mention, I know it's a telehealth company, and how interesting that it was really ahead of the curve, it turns out now, because everyone's doing telehealth right now during the pandemic, and it seems like Vital Decisions is really already has established that line of work by already being ahead of the curve and ahead of everyone else in doing telehealth. So it seems like you're well positioned right now.
Absolutely, yeah. So Vital Decisions was founded about 10 years ago by a critical care specialist and palliative physician, Dr. Jessica Zitter, who maybe some of your listeners know, and one of her colleagues who's a bioethicist, Helen Blank. And Dr. Zitter and Blank understood that and saw that care that individuals with serious or advanced illness were receiving was often misaligned with their values and wishes, and that it resulted in the delivery of a lot of unwanted, maybe sometimes unwarranted, high-cost care. And they were taking, note of the physical and emotional discomfort this lent at the end of life experience for the individual. They were taking note of the confusion and turmoil often for the family. And so, yes, they founded the company with the intention of being a catalyst for change and really starting to think about how do we deliver care for those with serious illness in a different way. And though they started initially at the bedside, the organization very quickly pivoted in its initial years to the telehealth model. And boy, that was one of the best decisions I think the company has made, because it's increased access to people who may not have capabilities of getting out of their homes to have these conversations in the healthcare setting. And really, we can come right to the home at the right time. So, advanced to 2020, we've had the opportunity to serve more than 300,000 individuals and their family members. And we have a suite of services now that all focus on making sure that any care that is delivered is indeed aligned with what matters most to the individual. And so the core of our programs do deliver comprehensive advanced care planning services. And we help people to think through, define, and document and communicate those preferences for care, just to make sure that any care then that they receive is aligned with what matters most, whether that's now or in the future as their medical situation may change. And so in our core programs, we are generally working with people who are in advanced stages of illness, usually they're predicted to be in their last 12 to 18 months of life. And oftentimes in the process of doing advanced care planning with them, we are also introducing them to different types of care that may be available to them, and raising their awareness and educating them about such services. And those services can be palliative care and also hospice care. And in some of our programs, we directly link them to providers of these services. But recently, over the last couple of years, we've also looked at the idea of introducing and raising the concepts of advanced care planning much earlier in one's disease trajectory, and also starting to better socialize the concepts of advanced care planning, even for healthy individuals. And so a few years ago, we partnered with some physicians at Penn State University to create also a digital online experience called My Living Voice that I think we'll talk about a little bit later. And that's really intended for generally healthy adults who maybe are planning for a wedding or an upcoming surgery, and gets them thinking about the important elements of advanced care planning.
One of the things that I was really interested in about your model is that you actually contract with insurance companies and Medicare, and they pay you to do the planning with their insured patients, which I think that's really brilliant. And it totally makes sense that they should have a vested interest in wanting their clients and their insureds to have advanced directives and have done this planning.
Yeah, absolutely. So over the last 10 years, we've contracted with I would say probably 30 different health insurers. Those could be regional health insurers. They could be state insurance plans. They could be national insurers. And we cover all lines of business. So folks, a good chunk of of the people that we serve have Medicare Advantage plans, but we also very much work with Medicaid plans and commercial plans as well. Each of those groups have different populations, of course, and so we've had to adapt our programming likewise. But the wonderful part of this is when we outreach and start to introduce our services to people, and we let them know that this is a benefit that's offered at no additional charge to them through their health insurer, it actually provides a link very often. People will take a minute and ask to hear more about the program. And it is a huge investment by the health insurance industry. And in that way, I think, I'll share with you maybe a little bit more in a few minutes, just sort of about what that produces for them as well, in terms of having members who are more informed and engaged and involved in their care and activated to be good decision makers. They tend to be happier with their services that have been provided.
It's very interesting because I'm trained as a family doctor, so primary care physician, even though I did a lot of hospice work during my career. And I spend a lot of my time talking with other primary care doctors about why they need to talk to patients about their advanced directives, and they need to encourage patients to do the paperwork. And I've met so much resistance from doctors, and I've really gotten discouraged with the idea that doctors are just not going to be the catalysts for this kind of change. For one thing, they don't feel like they have time, they haven't been trained well enough, or they don't feel like it's necessarily their role to be educating patients and, spending this time one-on-one with patients, educating them. And so I realized that's not really the solution, to try to work through doctors and getting doctors to encourage their patients to fill out advanced directives. Though I found doctors are thrilled to know that their patients do have the paperwork. Yeah. They just don't want to be the ones who instigate it. So I love this model that you can work directly with the insurers to bring the patients in at the right time and help them. And you have trained specialists on your staff who help the patients. And it really takes the burden off the doctors in that way. I mean, doctors, I'm sure you get positive feedback from doctors all the time who say, oh, great, thank goodness. All these patients came in and they already had their paperwork done, and I didn't have to be the one to give them all this education.
Absolutely. This is really a special component, I think, of our services is the services are delivered. They are delivered telephonically. We also can do this by video session, but they're facilitated by non-physician specialists. So we hire master level counselors and social workers and give them extensive training. Most of them bring experience in ACP and patient-centered approaches to care delivery. And what is unique about this is, we don't act as the medical expert. We don't pretend to give medical advice ever. But what we are instead is a neutral guide with expertise in thinking about and planning for future care at the end of life and during your disease journey. And we come alongside people and support them. And in this way, it almost feels like we become a sounding board for folks, and they can hear themselves kind of talk out loud and process through different information that has been shared with them. And of course, all of our programs and interventions are structured, and we have a direction where we're headed in each of our sessions. We typically are working with people maybe 3 to 5 times over a period of a couple months. In order to help them really develop their comprehensive plan. But yes, then exactly one component of our program is preparing to communicate your wishes with the people who matter most. And those, of course, would include healthcare proxies or substitute decision makers, family members, and preparing to talk with your doctors. And so one of the wonderful things we've done in the last year or so has been creating a written summary of every conversation we have with a member. And we give that to them in between our sessions. And it helps them, especially if they've got doctor appointments in between their sessions with us. They can bring that summary along with them to their medical appointments. And it helps prepare them to have, and maybe to instigate a conversation with the doctor. And most of the time we find that physicians, if an individual is initiating that conversation, they're willing and able to engage. And oftentimes we'll help the individual think about which doctor maybe is the right doctor to start this conversation with.
That's a wonderful idea, to give the patient a summary, because I could imagine they have this warm and inspiring conversation, but then come away from it and a few days later are start trying to remember, okay, exactly how did that go again? What did we talk about again? And I can see how helpful that would be as a reminder, but also just even a way to show it to someone else and say, here's the conversation I had.
That's right. Exactly. It culminates in an advanced directive at the end of our work together. It can be integrated in our digital platform if folks prefer to use an online advanced directive tool, or it can be integrated with state in paper forms that are often used by folks as well for their advanced directives.
And I was curious to know, do you still find that people, even when you approach people about doing their advanced directives, do you still find people are reluctant or nervous to talk about these end-of-life issues?
I think it's a sensitive topic, of course, right? I think there are very common barriers that probably all of us have to overcome to really engage in this kind of conversation. Those barriers are cultural, emotional, social, relational, even just thinking about navigating the health system. And so I think it's being aware of what those barriers are and then sort of speaking to them. And I think we feel pretty confident that over the last 10 years, we've been able to see those barriers as something that don't need to get in the way, and that we come alongside people and help them to overcome them. I think the hardest part, honestly, is just culturally in North America. We really just don't see death as part of life. We see it as sort of separate, distinct time and something to be avoided. And I think our culture has sanitized and medicalized this experience. I think our healthcare systems in general have developed models that have tended to be a little bit more transactional, disjointed, and maybe for too long we're not measuring quality of care that was delivered at the end of life. I think this is starting to shift, which is awesome. And really putting the person back in the center of their medical care experiences. But yeah, I think there's sort of a lot in the system working against people that makes it very easy to avoid.
Yeah. I'm wondering if it might be easier, though, for some people to talk to, say, one of your specialists, someone who's objective, but they don't have any emotional attachment to, than it would be for them initially to be having this conversation with their own family members.
You're exactly right. Your intuition is right on that. So part of the reason why we hire counselors and social workers, and we actually screen for their capacity to demonstrate empathy in our hiring processes. And what we have learned is that empathy and the ability to come alongside and be a partner to someone, those two things really make a difference, really in the first few minutes of the call, but especially as you're starting to dive deeper into topics that are hard to think about, much less make decisions about. We do utilize a counseling method called motivational interviewing as our primary clinical approach. And this, we think, has really helped us with our ability to engage and invite people to step into this conversation. So your listeners may be familiar with motivational interviewing for other uses, like substance use treatment. But motivational interviewing is an evidence-based counseling methodology that has been found to be effective at increasing engagement and outcomes in any kind of health behavior change program. And we see advanced care planning as health behavior change. And it's also been seen as effective. Researchers demonstrate it as highly effective in telephonic uses. But if you're not familiar with it, it's a patient-centered, collaborative method for having a conversation that is empathic, affirming, and we say autonomy supportive.
I really love the idea of viewing advanced care planning as a change behavior, because I think that helps us understand even more why there are obstacles to it, because it's actually a big thing for people. It's actually really major for them to start thinking about the end of life and consider what they want. And so it doesn't necessarily come easily to them. And it helps us keep it in the proper perspective that you can't just sit down and say, well, which is what my estate planning attorney did. Here's a form. Here's a living will. Fill it out. Check off some boxes. You can't do that. It really does require education. And then I think that you're so wise to have multiple sessions with people too, because I'm sure they contemplate things in between each session, and a lot will come up for them as the conversation progresses from one meeting to the next.
For sure. And really comprehensive advanced care planning has quite a bit to it. So, we tend to start with understanding the person's medical experience. And we start with that because it puts the person in the driver's seat right away. Again, we don't have their medical records in front of us when our specialists are reaching out to them. So it's really up to the specialist to find out what the member's disease journey is and what their treatment journey has been like, who's involved in their care, and what really matters most, what's most important to them. But in terms of then engaging in the program, we work with folks to identify, what's been most important to them across their life, what values have really played out that might impact their healthcare decision-making as they move forward. And how might those values change over time? What factors need to be taken into consideration? Are they a caregiver? Or do they have family members still at home? Are there other responsibilities? And how do those factors weigh into some of the decisions they will make? But starting with that is what we found is that people will talk about their journeys, and people will talk about what matters most to them long before we start talking about, specific preferences for end-of-life treatment. If we started with that, we probably would not have as much success in keeping people engaged. As we move people through the program, of course, a big component is thinking about what are their goals for their treatment and what types of care might they want at different points along the way, including if treatment stops being effective and if they begin to continue to decompensate in their health. And as they start to approach their end-of-life journey, what other types of treatment they may want to consider. So again, we're generally engaging folks that are in advanced stages of their illness. So it may be something that they have started to think about. And in this way, over the course of a few conversations, we can gently bring them to the point where also they can be thinking about, okay, when am I making different types of decisions? And what is palliative care? And how might that help me if I'm starting to experience more suffering and pain? And what is the difference between palliative care and hospice care, which we often find there's still a lot of confusion.
Mm-hmm. Even amongst medical providers, there's a lot of confusion about that.
Exactly. And this culminates to, I think, another thing that people can usually pretty easily do is identify who would speak for you. If you found yourself in the emergency room tomorrow, who would speak for you? If they had to make medical decisions for you, you were unable to speak for yourself. We call that a healthcare proxy. That's also something that people can usually talk about that pretty freely. And then later in our program, we'll talk with them, well, what does a proxy need to know? And you would be surprised. I'm sure you're, as a physician, maybe not surprised. So many people have maybe said, oh yeah, my son or daughter would be the person who would step in. But oftentimes the son or daughter does not know that they are chosen for that role. Mm-hmm. We work with people to prepare other significant others who might have a role, or even who might just show up when there's a crisis, about what their role would be and what is most important. It's one thing for an individual to share it with us, right, or to document their wishes, but it's quite another when they've been able to do this work and really have a meaningful conversation with the people who they love and with their doctors. And what we find is when people do that, it really affects change at their end of life experience.
And so it sounds like you practice, or you help them prepare for those conversations so that they're much more likely to actually have them.
Exactly. Yes. So there's a whole sort of module of our program that is focused on communication. What are the types of things that you would want to let people know? How, do you select those people? What are the types of things that you can say? What documents might you want to share with them? How to prepare for their responses? What roles you can give other people. We spend quite a bit of time. We have patient tools that we've developed for our programs as well. So these are easy to read, educational materials, essentially, that people can also share with their loved ones too.
I think that's so helpful, because I've encountered so many people who tell me they're really afraid to talk to their children about what they want at the end of life, because their own children don't seem comfortable with hearing about it, or even thinking about the idea that their parents will die one day. And so it seems like this, to assist them and help them envision that conversation and how to do it is so helpful, because if they just fill out the paperwork but they don't ever share it with anyone, then we've lost the point of all of this.
That's right. And we find actually the concern about being a burden to one's children is often the very reason they will begin to do this work with us. So so it's sort of like, on one side, they may say, I can't even imagine starting to talk about this with my daughter. Like, she's going to fall apart. She wants me to keep getting treatment. But on the other hand, if I don't talk about this, I'm worried about the burden this may place on her if she ends up having to see me in a state that I will be in, if she ends up having to make decisions and not feel prepared about what I would have wanted. And oftentimes, the other thing that will motivate people to do this work with us usually is an experience that they have had. So sometimes if we can call upon, the loss of a loved one, or the experience that someone close to them had that maybe was less than optimal, that can often be a motivator as well of, geez, gosh, I don't want to, go the way my friend did, or I don't want to put on my kids the responsibilities that I had for my parents when they passed. So sometimes it may sound like resistance or, but oftentimes if we gently explore that together and stay curious about that experience, we learn that that very thing can then turn into a motivator for engaging in advanced care planning work together.
And that's exactly what was really helpful for me in reviewing these issues with my own mom, was to ask her to tell me what it was like when her parents died. She had a lot of stories and a lot of negative feelings about things that happened, and her mom being resuscitated multiple times. And it was really easy to go from there to say, what would you like to be different for you? And here's a way to make sure that doesn't happen to you. And so I think you're very right on about that these past experiences really do motivate people.
Yeah. Boy, it's such an amazing gift to give our loved ones, to be able to, although they know it's not always a conversation everyone wants to have, but to be able to incorporate these kinds of conversations into our life and into our relationships with those who matter most to us. I think it brings a sense of clarity and peace for those involved. And we've seen that over and over again. We will send patient satisfaction surveys, during our program, and 6 months out after someone's participated. Sometimes they have passed and their loved ones will complete our surveys. And we hear this over and over again, that thank you for being willing to have this conversation with my mom or my dad. Thank you for helping us as a family be prepared. How do we help more people learn about this? And we are actually, one of the cool things about our program is we're able to engage whomever else that individual would like included. And so if it's easier to have your daughter or your son participate in one of the sessions with our specialists, you can do that. We can have a video session together with the individual and their children or the spouses. And so in that way, we can unpack it together as well for people that prefer that.
That sounds so helpful, because I can just imagine that you can also kind of bring the family together and help get everyone on the same page in a way. And it prevents some of the miscommunication that happens sometimes, because I've seen it happen when a patient may communicate with each child at a separate time, and each child comes away thinking something different, drawing a different conclusion from the conversation they had. And sometimes we find a lot of conflicts over that. So I just see being able to assist with that communication could make a big difference.
It makes all the difference, for sure. It makes all the difference, and also helps people to feel more prepared about the shifts that may be coming down the road. So, if we've talked about, I'm going to go for this third round of treatment, we're on the same page. If we've talked about, if that third round does not work, what then? If we've talked about, if I start to feel a lot of pain and discomfort, what then? We've talked about, where do I want to be? If I decide to stop treatment, where would I want to get care? These are all just huge decisions for families to have to navigate if they don't have any guidance, or if they don't have a sense of what a person would want, what their loved one would want.
I can see how your specialists have to be really creative in the moment, because there's no one script for any of this. I mean, they have to really be great listeners and able to think in the moment about which way to take the conversation and what to ask next. They're
really special people, if I could just brag on them for a few minutes. Sure, they are, again, I think very empathic. They are trained to be very good listeners. We invest in them quite deeply, with lots of resources and supervision and coaching. This may sound funny, but we record their work, and we score their work so that we can give them data on how aligned they were with their client or their family that they were working with. It gives them a sense of a way to sort of measure their own growth and skills over time. And we have found that then it really helps us to then focus in on the areas of training and development that they need, and really help to hone their art and their craft, because it really is an art, and we're just so grateful for them.
Yeah, definitely. That they have to have a passion for doing it in order to actually do the work, I'm sure.
They do. Many of them have their own personal journeys as well. Maybe have lost a significant other, lost a parent, have experienced the healthcare system in a way that they would not want others to experience. And that does motivate them to do this work. But also the words of the people that we serve really motivates them too. And so when somebody has truly engaged in effective advanced care planning, and we get to hear about the impact of that on their care, boy, is that motivating. It really helps you to understand the value and the impact of the work that you're doing. But it's very personal. And for that reason, it is also something that we have to pay attention to, because it's a lot. It can be a lot to, just like any caregiver, any role where you're serving and caring for others, it means you have to also take good care of yourself.
Yeah, definitely. Well, and I'm interested, I think we're talking about the multi-session work, and I think is that the Living Well program that we're talking about within Vital Decisions. And this is the program for which insurers reimburse you for this work. And I'm wondering if you have statistics from the work you're doing about changes that you've seen over 10 years and the results of helping people with these advanced directives.
Yeah, absolutely. So with each of our health insurers that we work with, after a period of time, we will do an analysis with them. We've done about 36 of these independent analyses to demonstrate. We basically take a cohort of people that have worked through the program that were, members of their health insurance, and compare that to a control group of members of their health insurance who did not have access to our program. And then we are able to demonstrate, first and foremost, really high rates of patient satisfaction. That's probably what they're interested in first. So health plans want to know that this is a service that their patients value. And so we're able to share with them overall our satisfaction rates are about 4.5 out of 5. And then we're able to show them through this analysis that people have, in their end-of-life experience, typically in the last 6 months of life, that there are lower rates of accessing inpatient or acute care. And so we see that as a positive predictor that we have helped people think about the type of care and kept them out of the ER or other acute settings. So there's between 15 to 25% lower inpatient admission rates, typically for members who participate in our program, 20 to 30% fewer hospital days. And at the same time, we see about a 30 to 40% increase in hospital utilization as compared to people who have not gone through our program. And the total number of days is about 40% higher than people who don't have access to our service. So those results are quite telling. What that also then financially is it helps the health plan. The health plan usually typically sees an average of a 3-to-1 return. So they've invested in this program. It's resulted in greater patient satisfaction, higher quality of care, and it happens to also be have some cost-saving measures for them as well.
And this is exactly what we're hoping for with advanced care planning, is to help patients avoid unnecessary and unwanted care at the end of life that actually might decrease their quality of life and their enjoyment of life. And so it's helping us overcome that default level of medical care where everyone gets everything, the most aggressive care possible. If they come in the ER without an advanced directive, they're going to get a very expensive course of care that they may not want at all, and that may not enhance their end of life. And so this is exactly what we want to see. It is making a difference. And so that's what is really encouraging to me, because I know we've been believing it all along. If we can help get people educated and get them to complete advanced directives, it will make a difference. And so it's so nice that you actually have quantified the statistics for us, so we have evidence of that now.
It is, yeah, it is. And, the wonderful part is as well, again, our role in delivering these services is not to discourage folks who may also want to have, resuscitation at the end of life, or would, who want aggressive treatment. But what we find is when you do educate and you raise awareness, that 90% of people, once they are aware of the type of care that will be offered to them, if they find themselves in those critical situations at the end of their life, 90% of people will choose care that is more selective and more focused on the quality of their life and more focused on the comfort and being able to incorporate the people and be in a setting that they want to be in. And so, yes, it's all about helping to raise awareness of what will happen if no action is taken.
Mm-hmm. Which is exactly what people need to know. Everyone needs to have that information at hand, because we're really left stranded if we don't understand that. And if we've never had an experience with a friend or loved one at the end of life, a lot of people just may not know what kind of care awaits them if they don't plan ahead and make their own choices.
That's right. That's exactly right.
So I know, for Living Well, these are patients who are on the insurance plans that you work with. So they don't necessarily self-refer; they're kind of chosen or selected for the services. Is that correct?
Yeah. So we employ proprietary analytics, utilizing data from the health plan. And we help the health plan to identify people who are on a particular course with a variety of diseases. And the model helps us to predict those who may be at different stages of illness. So it looks at different factors: claims data, pharmacy data, social determinants of health, those kind of things. And it's an AI model. It's beyond my brain, but it helps to appropriately identify people who could benefit and who are, again, in advanced stages. And then that, coupled with some outreach by our specialists will reach out, we'll send a letter, and then we'll also call members. And, not everyone is always ready, or sometimes even as sick as you may have thought they are. And so there's a process that we go through to sort of medically qualify those who participate in that program. But what we find is, for those that we reach and those that are medically eligible, we're able to engage close to 60 to 70% of those in our Living Well program, which is really quite astounding.
Yeah. That's really good, and you're reaching the population of people who really need to do the planning, but on their own would not have sought it out, would not have gone to someone to say, "I need an advanced directive, help me complete it." And so you're offering education to a group of people that otherwise I think we may not reach through other efforts.
That's right. And sometimes folks have had a similar experience. I think you mentioned one of your own where they may have filled out a form as they were preparing for a surgery, or they may have done some other legal planning and filled out a healthcare proxy form, but they aren't always aware of what those forms mean. And so we also can work with people who've had some prior experience with advanced care planning to help them kind of pull that out, brush that off, think about, do those directives apply now? And also, one of the things that's really important is as their health continues to change, we also introduce the concept of medical orders and post and most forms, so that and help people understand the limitations of advanced directives, and again, raise the importance of communicating with your primary care physician or your specialist to help make sure if a medical order is appropriate, that is in place as well.
Do you remind people to revisit their advanced directives after a number of years?
We do. Yeah. So one of the final modules of our Living Well program, we go over the work that we've accomplished, and we talk about the frequency and the different conditions that one might consider reviewing. So if there's been a change in relationship, if someone goes through a divorce or there's a marriage, if there's a new diagnosis, if there's been other conditions that would just require different decisions, those are all good times. And even just sort of on an annual basis, looking at it, making sure, is the person I selected to be my healthcare proxy the same person that I would want now. It's amazing. Things change, right?
Yes, definitely.
It great sometimes.
All the time. Well, and then I wanted to talk about, I know you have other programs in addition, and I just signed up for My Living Voice myself today so that I could create an online document. And so it appears to me like that My Living Voice is available to anyone who's interested in it, and without their insurance company being involved. Am I right about that?
You're absolutely right. My Living Voice, we have made a free version available to the general public. We decided to do that early this spring with the onset of COVID, and understanding that with COVID, people who were generally healthy and may not have ever engaged in advanced care planning were finding themselves in the ICU and having to make decisions around ventilation. And so we made a decision to make My Living Voice available. And so the version that is your readers or your listeners could be accessed by going to your browser and typing vitaldecisions.mylivingvoice.com. And that is, again, a version that is intended for people who are generally not dealing with major health issues at this time, but it will help people think about what are the values that might factor into healthcare decisions. It also gives you a place to identify who your healthcare proxy will be, and it gives you the opportunity to indicate on, for life-extending treatments that may be offered to you if you found yourself in a medical crisis, what your decision would be on those. It'll also send you reminders to update this directive. And this directive can be downloaded and fully executed. It can also be shared electronically with people who matter most in your life and with doctors as well. So we've tried to make it to be as user-friendly as possible. It's probably a 10-minute experience. And then we've also used My Living Voice in our other programs. And so there's integration and deeper level of advanced care planning for its use in other programs as well.
Yeah, and I went through it, I found it just exactly the words you said, user friendly. That it's very simple for anyone to complete and to understand. And you also have a lot of links to additional information. So if someone has a question about something like, what does that mean, or how would I think about that, they can click on the link to read more and learn more about it. So it's very informative.
Oh, thank you. That is great feedback. We're pretty happy with that. And we have found that, yes, keeping it user-friendly is really important, not making it too onerous to complete. But yes, giving people access to more information, education, and resources should they want to has been really helpful. I do want to tell you too about our Guided Living Voice program, if that's okay.
Yes, yes.
So we this year we launched an initiative with a California-based health insurance plan to help raise awareness about home-based palliative care. And so with members of this healthcare plan, we are outreaching to them telephonically, and we are learning about where, their health experience and whether or not they may be aware of what palliative care is and how it may help with any of their unmet needs. So we introduce them to the concepts of palliative care. We talk about what home-based care is, and we listen and understand whether or not this might be relevant now or even down in the future. And during the course of that, we also do use the My Living Voice platform to give them access if they have not already begun to do advanced care planning. It gives them a way to do that as well. But this is really a fantastic program. Again, I think I said earlier, it's such a misunderstood service, but one that could greatly help so many families as they're navigating a serious illness. And palliative care does not have to be at the end of life. It can be introduced while one is still seeking curative care. And it's really a patient-centered approach to taking good care of the patient, and surrounding that patient with people and resources that can help ease suffering and help enhance their quality of life. And so in this program, we actually can directly refer someone for an evaluation for home-based palliative care. And that's just been a wonderful thing. I think we've been able to refer close to 900 people just in the last several months. So we're really proud of this program as well, and would love to see more people be able to access it as well.
That's really wonderful, and something so needed. And again, I think to me, it seems like the right approach to be engaged with the insurance company who can give you the data to help identify who needs more information about palliative care. So you're not not just scattering it out there for anyone, but you can target the information to the people who really need it. And you're so right about palliative care can change everything. And I think that we need so much more emphasis on it throughout our medical system. And it still feels very clunky for most patients, and trying to get into palliative care or get a referral. And if patients were more educated about it, I feel like they would ask about it or request it when they have the opportunity.
Exactly. That's exactly it. Sort of raise their awareness, empower them with information, and allow them to make decisions and know how to access that care, whether they need that now or down the line.
Well, I'm just really encouraged to know that insurance companies are on board with this advanced care planning and investing in it. And that gives me a lot of hope. And so that's what about your model that was just so unique to me, but exciting. I find it exciting for the future. And I did want to know if you get much feedback from physicians.
Yes and no. I think we will always love more feedback from our physicians. I think those that do find that their members are well prepared to consider some of the options that may be put before them. I think in general, physicians tend to be quite busy, and it's been an area that we continue to focus on trying to understand how could we potentially better engage physicians in the program? Because usually it's typically from the individual themselves going to the doctor. We have the capability, and we with permission from the member, we can send a letter that explains to the physician what our services are and that their patient is engaged with us. So that can also help them to initiate a conversation about.
I'm still hoping we can change the medical profession, still trying to find a way to get through to doctors. But this is quite a change we're trying to bring about in healthcare. And so I guess part of your change management theory is that it takes time. It's a process. So we have to go each step one at a time.
Yes, and there certainly is work happening. I know the Massachusetts Coalition for Serious Illness Care, which we're a member of, is doing work in Massachusetts with the 4 medical schools to incorporate more end of life planning and provider education, physician education in the course of training. I think that's a big piece. And then also, that just again, you spoke earlier, the barriers of time and resources. Having access to the tools and the electronic health records and being able to locate these documents, there's quite a bit. But we find that, working together across the system with the patient at the center of care is going to help us to make a shift. And you're right in that the fact that the health insurance plans are willing to invest in this is a really good sign that change is happening in our nation.
Yeah, definitely. I'm very encouraged by that. So we're talking about vital decisions, which you can learn more about at the website vitaldecisions.net. And I encourage people to go there and check it out and sign up for My Living Voice. So you can do your online advanced directive because that is just a resource alone that people may want to refer others to for now who, as you were saying, someone who's not in an advanced illness state, but would like to have an advanced directive now as we're still dealing with COVID.
100%. Yeah.
So I was really thrilled to hear that this was founded by Dr. Jessica Zitter. I'm a huge fan of her work and her book, Extreme Measures, and the movie Extremis. And so, wow, kudos to her. A doctor who, she takes action. She helps create and start change where it's needed. And I have so much admiration for her. So
she is a wonderful gift to this world.
Yeah, definitely. So, Tracy, thanks again for being here and sharing all this information with us. It's really helpful. And as I said, encouraging and exciting for the future. And I feel like Vital Decisions will keep growing and growing rapidly because there's so much need out there.
Thanks, Karen. It's been a real treasure to speak with you today, and I'm grateful to share more about what we do with your listeners. And just thanks again for reaching out and connecting with us.
Well, you're very welcome. So take care, Tracy.
Bye-bye.